good afternoon to everybody, and I'm happy to be here and to contribute about what the health sector is doing about disaster preparedness. So the framework of knowing first what are the hazards in the area, and also how these hazards interact with the community, and what would be the likely impact in the people's health. So that would be the focus of my talk this afternoon. So I'm going to show you some maps to understand what exactly are the hazards that we are facing in the ASEAN region. So first, this is the earthquake hazard map. And you can see that the darker the red is actually the higher the risk for these countries. So we also have a map on the earthquake mortality. So not only the presence of the earthquakes, but also where these earthquakes actually happen is very important. So if it happens in a densely populated area, you would expect, of course, that there would be more mortality. There's also the flood mortality risk map. And there are seasonal floods. For example, you can see the Mekong region, where the Mekong River is, and that, of course, leads to seasonal flooding. And and of course, there's also the flash floods related to typhoons and tropical cyclones. And there's also the landslide mortality risk map, the drought frequency map. So these are all very important tools, and we're happy that we have the scientists. And we've heard from Dr. Lagmay earlier how science is actually helping other professions, and from the health professions, we're looking at their work as well, and enabled to also direct what we are supposed to be doing in the health. And of course, the volcanoes, and you can see that the Philippines and Indonesia share the big number of volcanoes, since it's in the Pacific Ring of Fire. And also the cyclone mortality risk map. And as already explained earlier, that Philippines is actually the one that's getting a lot of these typhoons. And finally, the multi-hazard mortality risk map. So it's important to understand that in disaster preparedness, knowing the possible impact of each of these hazards is important, but we also have to understand that the preparedness that's needed to increase the capacity of the community is actually very much the same, or maybe 80% of the work that needs to be done are the same. So there are only around 20% of work that's unique for each of these specific hazards. So what we're saying is, if we understand the presence of hazards in each of these countries, and maximizing the preparedness, 80% of the time you'd be able to achieve what you want to. So if we look at the disaster events also in the past, there are only 3 top causes of number of deaths, and these are the storm, earthquakes, and tsunami. And in terms of affected population, basically they actually affected, nearly all of them actually affected greatly the population. And I think that this has been explained as well, that in terms of economic losses, this also has bearing in terms of how these communities will bounce back. And this is also the economics, as was already presented. And if you look at the past, from the 1970 to 2013, there were 4 worst disasters that were recorded in the region. In 2004, we had the Indian Ocean tsunami, where around 230 to 180,000 people were killed and affected 14 countries. We also had Cyclone Nargis in Myanmar, which recorded around 130,000 deaths, but then they stopped counting after that, or at least we didn't hear any more after that count. But it was suspected that there were actually more deaths than was recorded. Then we had the 2006 Yogyakarta earthquake and the 2013 Typhoon Haiyan. And also, there were more than 6,000 people killed in these events. So, what are the usual impact of these disasters? Of course, the usual reported are the number of deaths. What's not usually reported is that the deaths actually happen not only because of the direct impact to the events, but also the indirect impacts. And if you look at the long-term impacts of this disaster, it's actually more than what is usually reported. We have, for example, we have recorded a number of deaths due to Typhoon Haiyan, not because of drowning, but more deaths were actually because of public health emergencies like leptospirosis. So this also happened in Typhoon Sendong. So what we're saying is there's a need for the public health sector to also address the possible impacts of these disasters, to be able to save lives and also to be able to minimize the loss of, minimize the cost of hospitalizations and care for this affected population. It was already discussed previously about population displacement, so how the social work is very important in terms of dealing with people who are displaced because of these disasters, especially in long-term events. So we have not discussed so much about armed conflicts, but in terms of the burden that armed conflicts impact on societies, so not only health, but also in terms of cost, I think it's also something that we have to address. New cases of disease and disability. There are vector-borne diseases that also emerge after a disaster. So as I mentioned, it could be leptospirosis, it could be dengue, although dengue is now an all-seasons public health emergency. So it used to be only during the rainy season, but we're also seeing spikes of dengue outbreaks even during summer. So there should be a strong surveillance for each country to be able to catch and to be able to prevent complications from these diseases and disabilities. There's also increased number of cases of psychological and social behavioral disorders. So as a part of the coping mechanism of these survivors, they could turn to risk-taking behaviors. They could turn to alcohol, they could turn to substance abuse that would lead to more problems. And also, sometimes it's not recorded that even patients with maintenance medicines, because of the disaster, they are unable to get this. And that, of course, would lead to worsening conditions. Possible food shortages, of course, and nutritional deficiencies. So you can imagine that in long-term impact of disasters, for example, those who had to be relocated and could not come back anymore after the Typhoon Haiyan, those who were living in areas that are in the coastal areas, they cannot go back. And so they had to wait for their houses to be built. And you can imagine what kind of impact this has on their lives and also in their nutrition and on their health. There's also the issue of contamination or injury of relief personnel. I can remember one event that where this happened in the Philippines was during Typhoon Frank, and one ship actually sank, and it was containing some endosulfan, and they had to stop the rescue and the retrieval operations because of the threat to the health of the rescue personnel. Environmental health hazards. So exposure to asbestos, especially if there are old buildings that were damaged, and also if there are other chemicals where the event happened. Damage to healthcare facilities and other health infrastructures. We're especially watching out for the hospitals. So in any emergency, the hospital has to remain functional. And if the hospital is the one that is that's actually damaged from the beginning, then that community is going to face more hardships. This is why there were interventions done in the past, making sure that hospitals are also resilient to disasters. I think we learned a lot from this during the Typhoon Haiyan, wherein hospitals in Tacloban City were actually damaged and were not functional for several months. And with the damage to health facilities, of course, there would be disruption of routine health services. And this is very important in public health. If we are unable to provide routine health services like immunization programs, then you can imagine that sooner or later you will have problems on outbreaks. For example, measles outbreaks among children. Disruption of routine disease surveillance would also have the same effect. So if our routine surveillance on tuberculosis, our routine surveillance on other infectious diseases would not be continued, then the programs for the control of these diseases would also be damaged, and it will take years for the communities to recover and to be able to go back to the targets of decreasing the prevalence of these diseases. There's also diversion of development resources to emergency relief, and I think this is, I also explained earlier. So in terms of, instead of money going to development, many of these funds had to be channeled to relief, and of course that also sets us back in terms of our development goals. So if you look at this diagram, it's just showing what are the health services that are needed when an emergency or a disaster impacts on a community. So in the beginning, there's the need for search and rescue, there's the need for first aid and triage, and of course the medical evacuation. But after that, the disease surveillance should be in place. There should be curative care, blood banks, and this is where the Philippine Red Cross has been very helpful, laboratories, the referral system, and special units, so especially if there are needs for trauma or burn treatments. Evacuation centers, water, food and nutrition, energy security, environmental health, primary health care, care of the dead, psychosocial care, disability care. So these are all the services that need to be are needed to be in place after a disaster happens. And with all these needs, the United Nations actually came up with a UN cluster approach, and this is basically assigning specific UN agencies to be responsible, to be the lead agency for these specific needs of the population. So, for example, you can see that the World Food Program is in charge of logistics, the WHO and UNICEF for the health and nutrition needs of the countries. You'll have the Red Cross for shelter, and you have the UNHCR for protection. You have the Food and Agriculture Organization for the food security, and so forth. So this is a way of the UN agencies to be able to ensure that the needs of the population at this time are actually addressed. At the country level, there are also counterparts. So for the health sector, the Department of Health of the Philippines, for example, is the one that is managing the needs on health and nutrition, and also partly the water and sanitation and hygiene in times of emergency and disaster. And the recent outbreaks in Ebola, avian flu, we've heard of the SARS in Singapore, but the recent ones actually was a wake-up call for WHO to reform the emergencies and humanitarian action that the WHO has been running. So they were heavily criticized during the Ebola outbreak in Africa. And I think it should also be a wake-up call for us, especially during influenza season. There's a lot of virus that can actually be a cause for pandemic. So this is not to scare you and to scare everybody, but there's a need for a strong surveillance system to be able to catch outbreaks that can happen from one country and can be easily transferred to another, especially that people are traveling more these days. So what WHO did is to to reform its emergency and humanitarian action, but basically still focusing on strengthening the overall capacity of countries to manage all types of crises, reduce the effects of disasters and crises on systems that support good public health, and ensuring effective, efficient, and timely action to address public health priorities, and ensuring that the local health system is back to functioning. So there was a call for making sure that there's sufficient funding, for example, to be able to address emergencies and potential pandemics in the region. So we have seen how WHO is acting, for example, recently in the issue of plague in Madagascar. And I think also locally in the Philippines, the Philippine Red Cross has recently called also the health sector to be involved in making sure that there is pandemic preparedness for the Philippines. So what are the objectives of the WHO? It's minimum, the goal is to have minimum health impact of emergencies. And you can read the objectives. So building the capacity of member states to manage the risks of emergencies and disasters, to mitigate their health consequences, deliver effective humanitarian response and health cluster leadership in acute and protracted emergencies, and third, lead and coordinate global efforts for emergency disaster risk management in health and humanitarian health action. So that's the role of WHO. In the region, when I say the region, it's the Asia Pacific, there's actually an existing network of nurses and midwives that's also aiming to help advance the professional network to promote the nursing's ability to reduce the impact of emergencies and disasters on the health communities. So, on the health of communities, this network has been very active in terms of capacity building, in terms of doing research, and in terms of sharing resources. So, one of which is a publication on the best cases in terms of disaster management. It features, for example, in Cambodia, what were the roles of nurses during the riverine floods. In Indonesia, the lessons learned from Yogyakarta and Central Java earthquakes. And in the Philippines, the disaster preparedness and response during Typhoon Haiyan. Locally, in the Philippines, the Department of Health, the Health Emergency Management Bureau, was the one acting as the coordinating unit and operation center, and been responsible for the capacity building also of all public health workers. And there are a number of training and workshops regularly conducted by the Department of Health, HEMB, so that's what it is called. And there was also a project that was launched, I cannot remember exactly when, this was before Typhoon Haiyan, when as a tool, so the use of technology to be able to report real time what's happening on the ground. So being an archipelago, it is a problem how to get information, how to gather information quickly that can feed information and can help us plan response. And SPEED, which is an acronym for Surveillance in Post-Extreme Emergencies and Disasters, is actually using SMS. So there are personnel who are trained in how to gather data and what to report, and this goes to the central office, wherein immediate planning is being done to be able to address the concerns. So this is one way of monitoring it's like a rapid health assessment of what the communities actually need right after the impact of an event. As we know, it usually takes several days even for response to arrive, especially when the event happens in remote areas. In terms of the role of the academe, so I'm just going to show an example from UP Manila. So there is the Public Health and Emergency Management in Asia and the Pacific training course. This course actually was started, I think, in 2002 at WHO Western Pacific region, but then cascaded to the national level. And I'm sure some of the other countries who've been part of the regional course are also running their own national FEMAP training course. But this one is an important training on health emergency management for local governments. So in the Philippines, we have a strong national disaster risk management policy and plan that's actually being used and also being copied by other countries in the region. There's also strong partnerships between academe and other agencies, and in this instance, there's this example from UP Manila and the Philippine Red Cross. There is a strong movement of integrating disaster concepts in medicine and also in the nursing curriculum. And this partnership is actually going to address the needs in terms of the capacity building that's going to be needed in schools. And finally, the role of professional societies. So professional societies are also stepping up when there are disasters. One example is the Philippine Nurses Association. So there's an annual training of nurses in health emergency management. And they are also the ones that are called as volunteers during disasters. So they are mobilized. In the past, they've been mobilized in Typhoon Haiyan, Typhoon Sendong, during the Mayon volcano eruption, the Bohol earthquake, and also the yearly Translation event in Quiapo. And these professional societies also partner with other disaster management agencies or relief organizations. So that's it from the health sector. So thank you very much for your attention.